Diabetes is a disease with high blood sugar in the body which can cause various complications, one of which is diabetic foot wounds or diabetic ulcers. Diabetic foot wounds are wounds caused by infection or tissue damage in the feet of people who suffer from diabetes. Foot problems in diabetics occur over time when high blood sugar damages the nerves and blood vessels in the feet. Nerve damage, called diabetic neuropathy, can cause pain, tingling and even loss of sensation in the feet. If left without proper diabetes wound care, the wound will continue to open, get wet, and never heal. As a result, diabetics are more susceptible to fungal and bacterial infections through these wounds. In many cases, a serious consequence of wounds that do not heal is amputation. (1) Keep the wound closed and moist. Wounds will heal more quickly if there is a layer of moisture under the closed bandage. The only exception is when the wound is leaking too much fluid from within, which will require a more absorbent bandage such as aluminum. For proper wound care, clean the wound with saline, apply topical gel or antibiotic ointment to the wound once a day. 2. Clean the wound immediately. The first step that needs to be taken to care for diabetes wounds is to immediately clean the wound using running water and soap. After that, dry it and cover it with gauze or a modern wound covering according to the doctor's recommendation so that the wound is free from germs and bacteria. The way to clean a diabetic wound is quite simple, but you must continue to monitor the wound dressing and replace it if necessary, so that the wound remains clean. 3. Reduce pressure on the wound. The next treatment for diabetic wounds is to reduce pressure on the wound area. One way is not to wear tight clothes. If the wound occurs on the feet, especially the soles of the feet, it is recommended to wear soft, and comfortable footwear so as not to increase the pressure and damage the diabetes wound. 4. Prevents injuries. Although diabetic foot ulcers are common in diabetes patients, these wounds can be avoided. A person can prevent this by checking daily for signs such as foot trauma, ingrown toenails, cuts, bruises, sores, discoloration, and blisters. 5. Maintain blood sugar levels. Uncontrolled blood sugar levels will complicate the wound healing process, so keeping blood sugar levels normal is one important way to treat diabetic wounds. Maintain normal blood sugar levels by exercising regularly, regulating food intake, checking blood sugar regularly, and being disciplined in taking diabetes medication as recommended by your doctor.